Good morning. Today we're going to talk about the bones of the leg and foot. If you remember from yesterday when we talked about the bones of the pelvis, we learned that the pelvis together forms the pelvic girdle. Okay, and a girdle is bones that come together to form an attachment point for a limb. So either the arm or the leg. So in this case, the pelvis is going to anchor the leg to our lower extremity. The first bone that we're going to talk about is the femur. Okay, and the femur is the longest bone in the body as well as the strongest bone in the body. Okay, you can see that it is bigger and stronger than any of the bones of the upper extremity, which we talked about last week. And that is for several reasons, because it bears the weight of our body. Okay, it is the brunt of catching when we are running and jumping. It catches that weight and disperses it through the rest of the body. So the femurs have to be very, very big, very strong, and be able to withstand a lot of force. The proximal head, of course, we know that this is the proximal end and this is the distal end. The proximal head, this rounded area, is what forms the ball part of the ball and socket joint that is known as the hip joint. Okay, so this hollowed out area is that socket, and the ball just fits right inside there. Okay, when we're looking at attaching the femur to the pelvis, we have that socket part, like I just mentioned. This hollowed out socket is what we call the acetabulum. Okay, it's the socket of the pelvis where the head of the femur just sits right in there, and that attaches the leg to the torso. Like I've said, the acetabulum, okay, that socket of the pelvis and the head of the femur together form that ball and socket joint. It's a ball and socket joint, which is wonderful for us because then it gives us extra motion. Okay, we don't have a lot of motion out to the side, but we do have a little bit of motion out to the side because of that ball and socket joint. And then we can also have hip flexion. So we can turn and we can lift our leg up. We use that motion for walking, running, jumping, all those things where we have that motion through that ball and socket joint, through the hip joint. Okay, then the next bone that we're going to talk about is the patella. And the patella, if you recall from when we were studying the types of bones, is it's a short bone because it is wider than it is long. It's cube shaped. Okay, so it's a short bone, but it also is a sesamoid bone. Okay, and you'll remember here that a sesamoid bone means that it is in a tendon, okay, in a tendon or ligament. So it's within that soft tissue rather than other bones that aren't enclosed within that soft tissue. The patella is also known as our kneecap. It's very short, it's very flat, small. We have two of them, one on each side, and it lies anterior, so it lies in front of the articulation between the femur and the tibia. We haven't gotten to the tibia yet, but when we're looking at what we call the knee joint, that's an articulation between the femur and the tibia. So when we're actually looking at the knee itself, it's the femur and the tibia. The patella sits in front of it, and it's involved in a little bit of that motion too. It helps with sliding and gliding. But it actually is separate from that technically knee joint. Okay, so when we have the tibia, we have the femur, and we have the patella together, that makes that knee joint. Then, of course, we can't get too far without establishing what the actual tibia is. Okay, and the tibia is what we consider our shin bone. Okay, it's the bigger of the two lower leg bones. And all of the weight from the femur comes onto the tibia. It's the weight-bearing bone of the lower leg. It runs down the front of our shin. If you feel your lower leg, you can feel the front ridge of that tibia because it's very superficial there. Okay, runs just right under that skin. It joins the femur and the patella proximally. So we have our femur here, and then we have our tibia joining right on to the femur. And of course, we have that patella that rides in front, okay, which forms that knee joint. When we are looking at the distal end of the tibia, it kind of flares at the end here and it forms a bony prominence. Okay, that bony prominence is called the medial malleolus. And that's just on the inside of our ankle. If you take your ankle and you look at your ankle, there is a ball or a lump on the inside of your ankle. And that is the medial malleolus. It's that end of the tibia. Okay, like on my friend here. So we have the joint at the top. The tibia joins that femur with the patella sitting in front. And then at the distal end, we have that medial malleolus, which helps form part of the ankle joint. We all know that there are two bones of the lower leg. Okay, so we have the tibia, which consists of the bigger of the two bones, the main weight bearing of the lower leg is that tibia. And then we also have the fibula that is also there, but it doesn't bear any weight. Okay, so it just kind of hangs out there. It helps give up the ankle some bony stability. So it helps with when we're spraining our ankle or rolling our ankle during sports activity. It gives us a little bit of bony stability there. It runs parallel to the tibia. It's very, very well hidden with muscle tissue, okay? If we take our calf, you can feel, like I said, you can feel that front ridge of the tibia very well, that anterior ridge. But it's very hard to feel the tibia other than at the distal end and at the proximal end. At the proximal end, you can feel the head of that fibula a little bit. And then, of course, at the distal end, you can feel what we call the lateral malleolus. Okay. At that distal end, we have a flare in that fibula again, which is a big, strong, bony prominence there. And it's that lateral malleolus. It's the lateral side of our ankle. So then the tibia, the fibula, and the talus come together to form our ankle. Then we have the, when we're running distally, then we have the tarsals, okay? And our tarsals in our lower leg, or our leg in general, our tarsals are kind of equal to our carpals, okay? Our carpals, of course, are the bones of the wrist, and our tarsals are the bones of our ankle. The tarsals are a group of 7 bones. They're kind of behind, or they're the hind foot. They're the back of the foot. They're behind the metatarsals, and they resemble those carpals. Like I said, they serve the same purpose in that they slide and glide along each other to help with that ankle motion, just like the carpals do in their wrists with wrist motion, but they're bigger, okay? Which makes sense because we don't need our carpals to bear as much weight as we would need our tarsals. Our lower extremity has to bear a whole lot more weight than our upper extremity. Okay, we have the calcaneus then, okay, and the calcaneus is our big heel bone. It is the very largest of the tarsal bones and forms that bony prominence on the back of our foot. Then we have the metatarsals, and I'm going to skip over here to my articulated foot. Okay, so all of these are, of course, separate, all the separate bones. And so we have all the separate bones of our disarticulated foot, and then so we can see that calcaneus by itself, but then we can see how it works together with the foot. Okay, so this is the calcaneus, that biggest tarsal that we talked about. This is the talus, which is that bone that articulates with the tibia and the fibula for that ankle motion. If we move forward then, if we move anterior from the tarsals, then we have the 5 metatarsals, okay? And those 5 metatarsals are comparable to the metacarpals in our hand. We have the 5 metatarsals, which start with the big toe, and they're numbered from 1 to 5. So we have 1, 2, 3, 4, and 5. Those metacarpal or metatarsals, and we can think metatarsals, it's got a T in it, just like toes, okay? So our metatarsals articulate with our phalanges. Now, we've heard the word phalanges before, right? Phalanges were our finger bones. We also have phalanges in the foot, okay? And of course, I didn't see that my picture there has metacarpal or metatarsals highlighted instead of phalanges highlighted. So I apologize for that. But our phalanges are those bones of the toes. Okay. Each bone individually is a phalanx. Collectively, or more than one, the plural of phalanx is phalange. So the great toe has 2 phalanges, 1 proximal phalanx and 1 distal phalanx. The toes then have 3 phalanges, or 3 phalanges. The proximal phalanx, the middle phalanx, and the distal phalanx. And then that is the entire, all the bones of the low leg.